Hi guys, today we will talk about the non-pharmacological treatment of diabetes mellitus as well as the hypoglycemia, which is usually resulted from the insulin therapy to control the blood glucose level. So when you are coming to the first point about the treatment of diabetes mellitus without having a drug, is the first thing what we have to do is monitoring your diet, starting to the carbohydrate, which is the most contributing kind of nutrient for the increasement of our blood glucose level. Especially the carbohydrates have two forms. It may be a simple or a complex form. From the simple carbohydrate, a refined sugar as well as a beverages that have an added sugar as like that of the soft drink should be completely cessed in order to control the elevations of blood glucose level. Rather, the complex kinds of the carbohydrates, as you see from the screen, are important to control the blood glucose level. The second kinds of the nutrient we should have an adjustment is a fat. As we know, there are three kinds of the fat. That is animal fat, a hydrogenated oil, or monosaturated and a polyunsaturated kinds of the fat. From them, a monosaturated or a polyunsaturated kinds of the fat are recommended or advisable to be used for the individual, or they are helpful to control your blood glucose. The second thing to control our blood glucose level is an exercise that should be aerobic, moderate in its intensity, should be performed for at least 30 minutes per day. That means for 150 minutes per week expected to be done for the individual having a diabetes mellitus. You can see this from the screen, what kinds of exercise are important for reduction of the blood glucose level. The third point what we have to do is smoking cessation, stopping the smoking. Normally the smoking have its own drug or a drug content. Such drugs have a precipitating as well as aggravating effect for the increasement of your blood glucose level, so you should completely stop smoking. The other thing what we have to do is normally monitoring. That means a self blood glucose monitoring that is expected from the individual patient. Normally the target blood glucose level after having a pharmacological or non-pharmacological treatment are varied depending on the patient condition, including the age. So you should have recommendation with that of your doctor and have a self-glucose monitoring is important action for monitoring the blood glucose. When we are coming to the last point, what we have to do when we have a hypoglycemia or sudden reductions of the blood glucose level, the first thing is a homemade, that is by mixing a 14 spoon sugar with that of a cup of water and have a drink can help us you for rapid increasements of the blood glucose and the avoidance of a sign and also symptoms of hypoglycemia. Or it may be by drinking a 200 ml of a Coca-Cola or a Mirinda helps you for the rapid increasements of the blood glucose level. That is the whole what about today's topic. Just have a subscribe. Thank you for watching.